Thank you, Tini, for the introduction. Happy to see so many people interested in this topic, and I'm happy to follow up on the presentation that Rich just was giving. How can ChatGPT matters to patients? I would like to address how can nurses use ChatGPT and how can it be used in health science education. I'd like to acknowledge Lisbeth van Bulk, who is my colleague with whom I'm doing all this work. I can confirm that we have no disclosures. In the unlikely case that there are people in the room who do not know what ChatGPT is, I can briefly state ChatGPT refers to Chat Generative Pre-trained Transformer. It is an artificial intelligence language model, and it's developed by OpenAI. It was trained with a massive set of written text up to September 21, and with a massive set of text, basically it has swallowed the entire internet. With all the information that is available on the internet, but also with all the biases that are available and are in the internet. And it is, like Rich already said, it is fantastically able to generate text that looks very natural, and therefore they make sense. But it has no concept, it has no knowledge in itself. And that is important to know for the rest of the presentation. We are talking about ChatGPT, but there are other systems as well, and to a certain extent we should expand it. Similar products right now are Google Bard, Pi, Eliza, MetaLlama, Baidu ErnieBot, and many more. You have to know these are chatbots. They are meant and they are developed to have conversations. They are not developed to look things up. That was the first critique on ChatGPT, but what is a critique today is solved next week. In the meantime, we do have search engines where ChatGPT technology is embedded, and now there are search engines that can be used for the same purpose, like New Bing, Google Bard, ChatGPT, but then with the browsing plugin perplexity.u.com. and many more. But let's come back to the main question of this presentation. How can nursing and health science education use it? And to a certain extent, Lisbeth and I, we did the same as Rich did. We went to ChatGPT and said, well, tell me about yourself. How can this be used by nurses and allied health professions? And there were some important or fascinating aspects that were indicated. In clinical practice, ChatGPT could be used to generate patient education materials, to automatic charting and documentation from structured data, generating medication lists and instructions for patients, keeping up to date with the latest research and guidelines by summarizing articles in concise and easy to understand format, and language translation to communicate with patients who speak different languages. If this is all true, that still needs to be proven. I indicated the fourth aspect here in orange because, like I said, ChatGPT does not have knowledge. And as such, keeping up to date with the latest research, that's not where it is developed for. It's not capable to do so. But like I said, what is a problem today is solved in a while ago. In the meantime, an Australian physician has developed BrightSpark. And this is a bit the technology of ChatGPT, but this is not fed with or not trained with the entire internet. This is trained with cardiology guidelines. So this means that the information, the data here, is trustworthy. And you can use this, for instance, as a resident or as any healthcare provider. You can go to the system And instead, if you have a question, instead of looking through the guidelines and find the answer, just prompt it in the system and you will get the answer, which is, once again, very well founded. Remember that the first aspect that was indicated when we asked ChatGPT how we can use it was to generate patient education material. Well, I'd like to present the latest study that we have done and published in this respect. We did a proof of concept study in which we used ChatGPT and Google Bard to improve the readability of written patient information. We all know that in general the patient information brochures and flyers that we make are too complex. It is generally indicated that it should be written at a level of a 6th grader, which means a 12-year-old. But if you ask me, write something at the level of a 12-year-old, I cannot do that. I don't know how a 12-year-old is reading and writing. So what we did is we selected 3 patient information sections from scientific journals. We ran it through ChatGPT and Google Bard, and we asked to reformulate it at the level of a 6th grader. We took a section from JAMA, from the Cochrane Review, and from the European Journal of Cardiovascular Nursing. And the original reading levels was 11 grader, 17 grader level, and 10th grader level. Obviously, too complex for the target audience. We ran it through ChatGPT and Google Bard, and indeed, the reading level decreased, which means it was less complex. It was more towards the reading level of a 6th grader. Not always that level was reached. What was fascinating here was that sometimes, and Google Bard even more than ChatGPT, was omitting certain parts of the text. Google Bard was even up to 83% of the text that was omitted, which means that clearly the text was simpler, but it was oversimplified by removing important pieces of the information. And therefore, we came to the conclusion that ChatGPT can indeed successfully simplify written patient information materials and improve its readability, but it cannot achieve the desired 6th grade reading level. Google Bard, on the other hand, is capable of reaching the reading level of 6th graders, but it oversimplified the text by omitting up to 83% of the content. Coming back to our initial question, how can it be used by nurses and allied health professionals in research? And the answer from ChatGPT was, well, it can be used to summarize large amounts of text, such as research articles, clinical notes, and patient records. It can answer specific questions about best practices, guidelines, and protocols for treating cardiovascular conditions. I've put this in red because it's not. Remember, it does not have knowledge, and it is trained up to 21. It does not have the latest information. It can generate structured data from unstructured text without the need for manual data entry. It can help for language translation of articles and studies from other languages, and it can be used as a writing assistant to generate texts that are coherent and grammatically correct. And that is how I am using this most. I am not a native speaker. When I'm writing, irrespective of the experience that you have, I'm making errors, grammatical errors, and a native speaker immediately sees this. I don't see this. Well, then ChatGPT is helping me in a sense like, okay, I should formulate this sentence like that and that and that, and it's removing the errors that I make. I also use ChatGPT to get inspiration. For instance, if you have an idea, or if you are given a task or a question and you really don't have a clue how to proceed with this, I go to ChatGPT and I ask it. And maybe 10 possible responses come up, of which you immediately can remove 5 of them because they are not what you are looking for, but the other 5 can make you thinking. And I'm not playing for copy-pasting and say, well, this is now my work. No, but it helps you to streamline your thinking. It helps you to think in a certain direction. So a writer's block, in fact, should no longer be an issue because you can go to ChatGPT to get inspiration for the next step when you're writing. Then the question, how can it be used in health education? Well, I'd like to refer here a new initiative from Matthijs Kluitmans, who is a cardiologist and engineer here from the Netherlands. And he developed a system which is trained for and can be used for medical consultation training. So it is developed to train the communication skills, in this case of general practitioner, but it can be expanded to all healthcare professionals. And indeed, how are we training the communication skills in our students nowadays? It's with role play, and it's not always effective, especially not for the introvert students in the group. Well, if they can practice with systems like this in a safe environment, that would be wonderful. It would help us to reduce the time that we spend in communication skill training, and it would really make it more efficient and effective for those where role play doesn't fit as much. Coming back to what I indicated before, the BrightSpark platform, this is also something that can be used by students or can be used in training. Again, it is trained by the cardiology guidelines, so a student can say, well, instead of going through the guidelines, when is pharmacological cardioversion indicated in AF? As a teacher myself, it's actually my dream that I would have a chatbot at my availability. Imagine that I could train a chatbot with the textbook that I'm using in my courses, with all my course material, and that this could be an added product that I could offer my students. I'm sure that the learning would be more efficient and more effective. Because if they have a certain question now, it may take hours to find the answer in the handbook or in the course material. Then, in such a chatbot, they can just prompt the question and they get the answer, maybe even with the sources where it comes from, so that they have directly the link to the course material. This is really something that should not be too difficult to train, and I'm sure that this would be a great asset for health education. So let me come to the conclusion of my presentation. How can nursing and health science education use ChatGPT and related technologies? Well, it can help for summarizing, translating, and correcting text. It can help to generate, but also to optimize educational material. It can help to get ideas. It can be a source of inspiration. It can be an educational chatbot, which is not there yet, but it will come. And I'm positive, I don't think it will take long. And it can help to train certain skills. And here we have the example of the communication skill training, but also other skills could be trained with technologies like this. I am very fascinated and very enthusiastic about what is happening now, because we are the privileged witnesses of these evolutions. And it is a cliche, but I think we can say that the future is now. Thank you so much.